Remarkable childhood, achieved all his key milestones, very happy, loving little boy. Just after his little brother was born, his behaviour started to change, which we put down to attention seeking. And then at school they started to notice that he wasn't hearing properly, he wasn't looking at the board properly and squinting, and we had some tests and they all came back as negative. It soon became very clear that there was something going wrong with his brain. His cognitive skills were lacking, he was walking into walls, dropping things, being very clumsy, not understanding what he was being told. And after about a 9-month diagnostic odyssey, I suppose, we finally got a diagnosis of adrenoleukodystrophy, and we were told there was nothing that could be done, just to go home. He probably had a couple of years to live. Within a few months of that, he'd lost all his abilities. He was in a wheelchair, tube fed, blind, unable to speak to us, couldn't even smile in the end, and he lived like that for 12 long years and eventually died when he was 19.
It must have been just obviously awful for you as a family to go through it.
Yeah.
Then with your second son, Aidan, you discovered, because you then knew about this disease, you discovered he had it, but it was very different because it was diagnosed early and he was treated. And that's the important factor, isn't it, for you? You
Absolutely.
Want genetic screening so that there can be early diagnosis, because Aidan is now 19, is absolutely fine.
Absolutely, absolutely. So once Alex was diagnosed, they immediately tested Aidan, who was only a year old at the time, fortunately, and he was put on a monitoring programme when it was discovered that he had ALD as well. And then when he was 7, it showed up on a routine brain scan that he was getting signs of ALD, and he had a bone marrow transplant and he's now at university.